If you're caring for someone with dementia, you already know the journey is so much more than just memory loss. One of the absolute toughest parts can be managing some of the difficult behaviors that pop up. So in this explainer, we're going to give you a clear, compassionate guide to understanding and responding to them, all based on expert advice. Let's dive right in. And right off the bat, I want you to know that everything we're about to cover is grounded in solid guidance from the Alzheimer's Association. This isn't just some random advice, it's information from one of the most trusted resources out there, and it's all designed to support you. Now, when you're in the thick of it, dealing with these behaviors, my gosh, it can feel so isolating. But I want you to look at this number. Over 90%. That's how many people living with dementia will develop at least one of these challenging behaviors. So the big takeaway here is you are not alone in this, not even close. What you're going through is a very common, though definitely difficult, part of the disease. Okay, so what are we actually talking about here? Let's define the problem. The medical world actually has a name for these behaviors, and it's really important because it helps us see them for what they are, symptoms, not somebody trying to be difficult on purpose. It's called BPSD. That's short for Behavioral and Psychotic Symptoms of Dementia. Really, it's just an umbrella term for things you might recognize, like aggression, agitation, or that confusion that seems to get worse late in the day. That's sundowning, or even wandering. The key thing to remember is that these aren't character flaws. They're symptoms caused by what's happening to the brain. And let's just be really honest for a second. Dealing with these symptoms is incredibly hard for you, the caregiver. The research is clear that this is often the single most stressful part of the job. And for so many families, it's the breaking point that leads them to think about moving their loved one into a long-term care facility. So if you're feeling stressed out and frustrated, please know those feelings are completely valid. So when these behaviors get really severe, what's the common response? Well, often we look for a medical solution, right? A pill. But that introduces a really serious dilemma we need to talk about. Okay, so here is the massive trade-off, laid out plain and simple. On one side, sure, antipsychotic drugs can sometimes help reduce aggression over a few months. But look at the other side. The FDA has a huge warning on these because they've found that these exact same drugs increase the risk of death in elderly dementia patients by 1.6 to 1.7 times. That is a gigantic risk to weigh. And because of that huge risk, the Alzheimer's Association is crystal clear in its recommendation. I'll read it for you. Non-pharmacologic approaches should be tried as a first-line alternative to pharmacologic therapy. What that means in plain English is, before you even think about medication, there's a whole world of other strategies you should try first, and that's exactly what we're going to focus on today. So, where do we start? We start with a little investigation. This is where you put on your detective hat. Think of the behavior as a form of communication. Your job is to figure out what they're trying to tell you. So before you react, you've got to investigate what might be triggering it. And where does your detective work begin? Well, here are 4 key triggers to look into. First, could they be in pain, maybe from a UTI, or even just constipation? Second, look at their medications. Did they just start a new one? Third, check the environment. Is the TV too loud? Is the room too chaotic? Or maybe it's too quiet and boring. And fourth, has their daily routine been thrown off? A lot of the time, the behavior is just a signal of a basic need they can't tell you about anymore. Okay, so once you've done some detective work, it's time to open up your compassionate toolkit. We're about to walk through some really practical strategies, no prescriptions needed, that you can use today to help de-escalate a tough situation and reconnect with your person. First up, let's talk about adjusting the environment. Sometimes the solution is as simple as moving them away from a noisy TV or chaotic room. You can try to redirect their attention to something they actually like to do, maybe folding laundry or listening to their favorite old song. And hey, never underestimate the power of a favorite snack. Sometimes you might even be the trigger, and just stepping out of the room for a few minutes can completely reset the situation for both of you. Okay, your communication is probably the most powerful tool you have. The secret here is to join their reality instead of fighting it. So if they think it's 1965 and they're late for work, arguing with them is only going to make things worse. Instead, go there with them. You could say, "Oh, okay, tell me about your job." Speak slowly, in a calm voice. Get down to their eye level. They might not understand every word you say, but trust me, they will always feel the emotion behind it. And finally, validate their feelings. You don't have to agree with why they're upset, but you can always acknowledge that they're upset. Just saying something simple like, "I can see you're really upset right now," can make them feel heard. Follow that up with reassurance. I'm here and I want to help you. And most importantly, I love you. That connection can be a lifeline in so many difficult moments. Now, look, while these strategies should always be your first move, the Alzheimer's Association gets it. There are some rare and really severe situations where medication might need to be part of the conversation with a doctor. But this is not a decision to be made lightly. Antipsychotics should really only be considered when the behaviors are a direct threat to someone's safety, theirs or yours, or if the behaviors are stopping them from eating, or if they're having hallucinations that are truly terrifying to them. This is when you sit down with their doctor and have a serious risk versus benefit talk, but only after you've already tried the non-drug approaches. And even in those cases, it is so important to remember this is not a permanent fix. The guidance is very clear. It should be a short-term thing used for the shortest time possible at the lowest dose possible, and you should be constantly checking in with the doctor to see if and when it can be stopped. Whew, we have covered a lot, from becoming a detective to opening that compassionate toolkit. And I know it can all feel a little overwhelming. But here's the thing, you don't have to do it all at once. The most powerful step is just the next one you take. So look back at all these strategies and just ask yourself one simple question. Which one of these could I try first? Starting with that one small change can make a world of difference. Thank you so much for being here.